The gentleman yields. The gentleman from Ohio is recognized for his opening statement.
Thank you, Mr. Chair. The decision here is about cutting health care or cutting taxes for the super wealthy. That is the assignment. That was the assignment that the president and the speaker gave to this committee. They said, find $800, $900 billion so that we can fund all of the tax cuts, particularly those for the wealthiest people in the country. And to do so, and I appreciate the chairman's honesty, he said, we're gonna focus on cutting health care for the people who don't need it as much. Or said differently, we wanna make sure that we're only giving health care to the people who need it the most. Who does not need health care? Who here or in this country doesn't need health care? Or the speaker saying it's only going to be for people with quote unquote real disabilities. That's what the speaker said last night. So they're not going to try to figure out how to make this more efficient. What they're doing is they're going to make decisions about who gets health care, who has real disabilities, based on how much money they can save. Here's how they're cutting. They're going to increase the cost for low-income people to go see a doctor. They're going to have all of this red tape and paperwork to make it impossible for people who are eligible to get the health care. That's what happened in Georgia and Arkansas and Alabama. They're going to cut subsidies for folks who are receiving it as part of the ACA. 5 million people are going to lose their health care because of it. They're going to shift the cost to states. And then they're going to tell the states, you cannot raise money to cover the cost through an additional provider tax. So they're handing them the ball and then tying both hands behind their backs. So I have a constituent, Aaliyah, who gets her health care in Ohio. Yes, she may lose her health care because Ohio can no longer pay for all of the care that she needs. They're going to end retroactive Medicaid for nursing homes. They're going to reduce the minimum number of nurses in nursing homes. These are all the ways that they're getting to the savings. Not at all to do with waste, fraud, and abuse. One of my colleagues said cyber criminals is a big issue. Absolutely, cyber criminals is a big issue. If you go to the GAO reports, they list all of these examples of waste, fraud, and abuse, none of which is in this bill. None of which is in this bill. All of this waste, fraud, and abuse is right here. We could take it up, including tackling cyber criminals. Here's the numbers. If you want to not cut health care for millions of people, take the top wage earners, go from 37 to 39.7%, that's $250 billion. Take the corporate rate, tax rate back to 28, that's $1.3 trillion. Add the billionaire minimum tax, that's $500 billion right there. That's $2 trillion. You can invest it in expanding Medicaid. That is what Americans need. Otherwise, this is morally bankrupt, politically disastrous, and it will be deadly for those who are going to lose their coverage. And I yield back.
Gentleman's time has expired. The gentlelady from Virginia.